The Laurel County Health in Motion Coalition is made up of several community partners that come together to work on our health priorities. Those partners include, of course, the Laurel County ASAP Board, the London Police Department, several members of the health department staff. Our local extension service is involved, our regional prevention center, the City of London safety officer is involved. We have some retired individuals, volunteers from our local hospital. Actually, St. Joseph London, our local hospital, is a very, very large supporter of our coalition, and they help us with facilitation efforts. So there's a lot of community partners that come together to work on the 4 health priorities that we are looking at for the next 3 years.
Like any other community in southeastern Kentucky for the past several years, we have been battling opiates. That includes prescription medication, heroin, anything that falls under the umbrella of opiates. The passage of Senate Bill 192, which is affectionately called the heroin bill, allowed for a lot of funds to be available statewide to try to implement different approaches to combat the opiate overdoses that we unfortunately are seeing too many of in our state and in our nation. We learned through the community health implementation program that we did via the Laurel County Health in Motion Coalition. We looked at those results and we decided that the community was really split on how they felt about the needle exchange program, but that they were very passionate about doing something for and towards a solution for the opiate overdose prevention.
First of all, we're involved in the Laurel County school system, so we visit the middle and high schools and we teach them drug education, because they are going to be the future of London and Laurel County. For people who actually have prescription pills in their household, they can come here to the police department 24/7 and drop off their pills in our Med RX return units. And there are cameras out front, so it's surveillanced, and they can feel safe dropping off those pills rather than having them in their household. Just recently had our entire department, all our officers who were out on the road on duty, trained in using the naloxone.
I think it's been a positive overall. I think it's been really interesting to watch how the department, the police department, the health department, ASAP, the school board have all come together and become involved in the community. You see the positives with the programs as far as the prescription medication return, the educational programs that we have going on inside the schools, and the naloxone kits that we have going into the cars. Because it's given us an option that we haven't had in the past. It gives us an ability to help that we may not have had, that we may have had to wait or to choose another course of action.
If we did not get the CDC block grant funding, the health department would not be able to facilitate the coalition and keep our community partners engaged in the process like we have been. We wouldn't be able to support those efforts that those other community partners are going out and doing related to our health priorities. So this grant is a huge benefit to our community and to our coalition.